About 5 years ago, Dartmouth College, my colleagues here at Dartmouth and I and others had come up with a pretty clear set of diagnoses of what are the underlying causes of the ills of the U.S. healthcare system. Inadequate information. So we needed much better information about what worked and didn't, and information that would engage patients. The second underlying problem with the healthcare system that we recognized was the remarkable fragmentation in care that is experienced by patients. Multiple specialists, if you're sick, multiple physicians, multiple institutions, all failing to coordinate care for an individual patient, especially once a patient was sick, once a patient had a chronic illness. And the third problem was we have a payment system that reinforces that fragmentation and rewards more care, not necessarily better care. So with those diagnoses in hand, working with Mark McClellan and others, Mark McClellan was the former administrator of the Medicare program in the United States, he and I and some others came up with this notion of accountable care organizations that would really do two things. They would address the first problem of inadequate information by making sure that they were reporting transparently on the outcomes and quality of their care, so we would understand how well they were performing. Secondly, we would foster organized delivery, so that instead of fragmentation, you have organized care. And third, we'd move from a payment system focused on increasing the volume of care, fee-for-service medicine, toward a payment system that rewarded physicians and hospitals for coming together as organized systems and reward them for improving care, not just providing more care. And ACOs started out, as a gleam in our eye. The Affordable Care Act included some language that we and others helped write, and there are now almost 400 accountable care organizations in the United States. 1 out of every 10 Americans is receiving care within an organization that has an ACO contract. We are starting to see some changes happening. It's really interesting how it's coming forward. They're much more diverse than we anticipated. Many of them are physician-led. Some of them are emerging from the safety net, from safety net hospitals or from community health centers. So they're much more diverse than we anticipated. And the early stories, the early evidence looks promising. There's starting to be some evidence emerging that these really are improving care, and they really are saving money. So it's early, but there seems to be tremendous promise to the notion that physicians and hospitals might actually benefit from working together toward a common purpose of improving care, improving health, and lowering costs.